This tutorial will tell you about some of the common defects of the heart. The first one we're going to consider is atheroma. Now, atheroma occurs when there is some damage to the endothelium. This allows LDL molecules to enter underneath the endothelium, and they start to release cholesterol deposits. After this, macrophages, which are a type of white blood cell, move in. They try to destroy the cholesterol deposits, but unfortunately are unable to do that, and they turn into things called foam cells, which actually release fat deposits into the atheroma. They then start an inflammatory response, which releases collagen fibres, which are the thick, fibrous fibres that you'd normally only find in the outer layer of the artery, and this can actually cause this atheroma plaque to become quite solid. The wall of the artery at this point is weakened. As you can see here, the pink muscle cells aren't forming the normal solid layer that they would in the tunica media. They've been interrupted by this atheroma, and that can weaken the wall of the artery, and that can eventually lead to an aneurysm where the artery bulges outwards and can even burst. The surface of the plaque can also tear. You can see there a tear in the artery wall. This then causes platelets in the blood to start producing blood clots. And those blood clots could block the artery, or they could even come off from this plaque and fly down the artery to a smaller bit of artery and block it completely. So the reason why this is related to the heart is because if heart arteries, the coronary arteries, are affected, then you can actually lead to either angina, which is pain on exertion because the artery is blocked and you can't get enough oxygen to the heart muscle, or even worse, complete blockage can lead to what's called myocardial infarction. This is where there's a lack of oxygen to the heart muscle, and those heart muscle cells that no longer get an oxygen supply can die, and that can cause entire areas of the heart to stop contracting, leading to a heart attack. This process can also occur in the brain as well, and if that happens, then it can lead to a stroke. So you can see in the picture here, there's a blood clot that has formed on the area of atheroma. It's blocked the flow of blood to an area of the brain, and that can lead to that area of the brain not working, which is a stroke. There are various risk factors for atheroma. Atheroma develops normally in everybody. Children have signs of the fatty deposits in their arteries, even at a very early age, and by the time you get to early adulthood, you will have some atheromatous plaques forming, but there are some factors that can make this process worse and lead to those plaques becoming large enough to block arteries. So, for example, smoking has a big effect, drinking alcohol, eating foods that are high in saturated fats, obesity, and lack of exercise. The next condition we're going to look at is abnormal heart rhythms. You can see here an ECG trace of somebody with a normal sinus rhythm. So this is the normal electrical activity in the heart. Sometimes this electrical activity can change. So somebody may have atrial tachycardia. This is where the heart beats faster than normal, even at rest. So greater than 100 beats per minute at rest. You can see that the ECG trace shows each set of electrical activity coming closer together. It speeds up. And this is sinus bradycardia, which is where there's a slow resting heart rate of less than 60 beats per minute. Now, these can actually be normal. A fast resting heartbeat may be somebody who's a bit older or unfit, and a slow resting heartbeat may be somebody who is very fit, but it can also be caused by disease. So a fast resting heart rate, for example, might be caused by an overactive thyroid, and a slow resting heart rate might by an underactive thyroid. This last one here is never normal. This actually can lead to somebody dying. It's called ventricular fibrillation. It's where random electrical impulses go over the heart. The ventricles cannot contract properly, and if this isn't corrected within a few minutes, then this person won't survive. It usually occurs after a myocardial infarction. The only treatment for this is to use a defibrillator, which is the electrical gadget that you see on Casualty and other programs like that, which restarts the normal rhythm. The next condition we're going to look at is aortic stenosis. This is where the aortic valve is unusually narrow and doesn't open completely. The aortic valve is one of the semilunar valves. It leads into the aorta. Its normal function is to close to prevent the backflow of blood into the left ventricle. from the aorta during diastole. So when the heart's relaxing, it normally prevents backflow of blood. In aortic stenosis, the valve is so narrow that it doesn't allow the normal amount of blood through during systole. So when the left ventricle contracts, it doesn't allow the normal amount of blood to go into the aorta. The cause of this is usually a birth defect, sometimes occurs with hardening of the valve with age, and it can also be damaged during an illness called rheumatic fever, which thankfully is very rare these days. And the symptoms that a person would experience include fatigue after exercise, fainting with exercise, chest pain with exercise, shortness of breath, and irregular heartbeat. These are all due to the fact that oxygenated blood cannot get to various parts of the body as quickly as it normally would, or even at sufficient pressure that it would normally be under. So, for example, fainting would be caused by not enough oxygenated blood getting to the brain. The treatment of this is to avoid strenuous exercise. The heart actually can fail eventually if aortic stenosis is not treated, because it tries extra hard to push blood into the aorta, and eventually the heart muscle can't cope with that and will stop. So medication is often used to prevent heart failure from occurring. And you can also replace the valve. So you can see here a prosthetic valve, which has artificial leaflets which are pushed open during systole and then which close during diastole. And the next condition is the hole in the heart. Now, the hole in the heart is actually normally present in every single fetus, and this is because when a fetus is inside the womb, it doesn't need to use its lungs. So this hole in the heart between the right atrium and the left atrium allows blood to flow directly from the right atrium to the left atrium instead of going into the right ventricle and going to the lungs. There's no need for the blood to go to the lungs when the fetus is in the womb. Now, after birth, there are flaps over this hole which normally close up, but in some people it doesn't close up, and therefore they don't get all of their blood going to their lungs on each cycle.